is the calcaneofibular ligament, and that is the ligament on the lateral side of the foot, and that prevents inversion. So I'm going to have you evert that foot, evert it, so you can feel that ligament just popping out right here on the lateral side of the foot, and that is the calcaneofibular ligament. And then we are going to do the lateral femoral epicondyle, and that is located on the lateral side of the femur, and that is just right here. And then we are going to the greater trochanter, and that is located on the femur. I'm going to have you stand up, then I have you pop your hip out, and here's that greater trochanter right here on our femur. And then the fibular head is located on the lateral side of her leg, and that is just right here. It's her fibular head just right here. The inferior tibiofibular joint is located between the triangular subcutaneous and located between the tibia and the lateral malleolus, and that is just the triangular subcutaneous area just above that lateral malleolus right here. And then the inferior tibiofibular joint is just between the tibia and the lateral malleolus, and it's just right here. And then the adductor tubercle is located on the medial side of her femur, and then it's where the adductor magnus inserts to, and that is just right here. And then the deltoid complex is the anterior tibiofibular, talonavicular, tibiocalcaneal, and the posterior talocalcaneal. And those are on the medial side of her foot, and those prevent eversion. And those are just right here on the medial side of the foot. They are deep, and so they are really hard to palpate. The navicular tubercle is located on the medial side of the foot, and that is kind of the bump, the projection on the outside of the navicular, and that is just located right here. That is her navicular tubercle. And then the MCL ligament is just medial to the tibial, just medial to the patellar tendon, and then you want to walk. So you want to start your patellar tendon. You want to walk until you get pushed out of that joint space to get the MCL, medial collateral ligament. And then the triangular subcutaneous area, I'm going to have you sit back. And the triangular subcutaneous area is located just above that lateral malleolus right here, and it is on the fibula, and it serves as an area for muscle attachment. And then the peroneus brevis insertion is located at the base of the fifth metatarsal, and it is on the lateral side of the foot, and it is just known as the styloid process, and that is the point for the peroneus brevis insertion. And that is it. So with the special test, the first one we are going to start is with the anterior durocine of the ankle, and that is testing the anterior talofibular ligament, and that is one of the first ligaments torn in an ankle sprain. And the anterior talofibular ligament prevents the talus from sliding out onto the tibia. So what we would do for this is we would just grab her by this cup her heel like this, and then just have one hand stabilizing the posterior leg, and we would try and pull the talus out from under the tibia, just like this, to test and see if that ligament is torn. And then the Lockman test tests the ACL. So I'm gonna have her flex one knee and keep the other one straight. And then the Lockman's test basically tests the anterior cruciate ligament, which tests if the tibia is sliding out under the patella. If it is torn, it will do that. So you want to have one hand stabilizing here, and then just one hand right behind her knee, and then we're just going to test ACL Lockman's test. And then for the Trendelenburg, I'm going to have her stand up. I'm going to put my hands on her iliac crest, which is just right about here. And then I'm going to have her stand on one foot. And then for this test, we were testing in the weakness in the gluteus maximus. If my fingers were not even, if my thumbs were not even on her iliac crest, that would indicate that there is a weakness in the gluteus medius muscle, and her hips would kind of sway to one side as she stood on one foot. And then for the Achilles compression, I'm gonna have her lay prone on the table. I'm gonna have her flex one knee, and this test is used to test an injury to the meniscus. So I'm gonna put one hand on her heel and then just one hand stabilizing her posterior thigh here. I'm going to compress the tibia into the meniscus, and then we're gonna internally and externally rotating the tibia to test and see and find the area where the injury is to the meniscus. If I was turning it internally and there was pain in the medial side of tibia, medial side of the meniscus, that would indicate an injury in the medial meniscus, and et cetera, and so on and so forth. And then the neuroma test, I'm gonna have her lay supine. And this is just to test for nerve compression in the foot. So for this test, I'm going to grip both sides of her foot. And then with this, she should complain if there was a damage or injury or compression with the nerve. She should complain with pain. And then for that particular area, if she says like, oh, there's pain in between the first and second toe, we would put a pencil in there, and then she would say that the pain would lessen because the pencil in there is supporting the bones and the structure of the foot and allowing for that nerve to essentially like release the pressure on the nerve and decreasing her pain. Okay, so now we're going to test the peripheral nerves, and the first one we're going to test is the superficial perineal nerve. I'm gonna have her close her eyes so she's not kind of guessing and kind of looking where my hands are stroking, so she doesn't get any misleading information, and I don't get any misleading information of sensory innervation. So for the superficial perineal, I'm gonna stroke the distal anterior third of her leg. You feel that? Mm-hmm. You feel that? Mm-hmm. And for the muscle innervation, I'm going to have her do inversion of the foot to test the muscle innervation for the superficial perineal nerve. And then the other one to kind of test bilaterally here. Good. And then the tibia is the heel of the foot. The tibial nerve innervates the heel of the foot, and it innervates the muscles for plantar flexion. So I'm going to have her close her eyes again. Ask her if she can feel the heel of her foot. Mm-hmm. Feel this one. And then I'm gonna have her do plantar flexion to test the muscle innervation. And then I'm going to do the other one, testing the muscle innervation. And then we are going to do the superficial gluteal, so I'm gonna have her side play. And the superficial gluteal innervates all the muscles for adduction, for the hip adductions. And then, so for hip abduction, I'm gonna ask her if she can feel that side of her hip. Can you feel this right here? Mm-hmm. Making sure that she has her eyes closed. Mm-hmm. And then I'm gonna ask her to do hip abduction. Good. Have her flip over and test bilaterally on the same side. You feel this right here? Mm-hmm. All right, and then I'm gonna have you do hip abduction on this side. Kind of test bilaterally the muscle innervation of the superficial gluteal nerve. And then the femoral nerve, I'm gonna have her lay prone, and the femoral nerve innervates the quadricep muscles. So I'm gonna have her close her eyes. Feel this? Mm-hmm. Feel this? Mm-hmm. Good. And then we're gonna have you do a knee extension for innervation of quadricep muscles. Good. And then the other one, we're gonna have her do knee extension. Good. You always wanna test bilaterally for the peripheral nerves to get a accurate measure. For the reflexes, we are going to be testing the Achilles reflex, which is nerves 1 and 2, and we're going to look for plantar flexion. So I'm going to put them over here. Sorry. And then I'm going to tap the Achilles reflex with the flat side of the reflex hammer, and we're going to look for plantar flexion. We always want to test bilaterally. Testing we're going to do is the glutes and gluteus maximus. So I'm going to have her flex her other leg because I'm on this other side. And then we're going to test for a 5/5 with full resistance against gravity. Good. We're going to test the other side for a 5/5 for flex the knee. Hand up on our hips, stabilizing. 5/5. Good. Okay, now we're going to do a break test. We're going to bring her up to mid-range, and then I'm going to try and break her out of it. Good. And then the other one, we're going to do a break test for this other side as well. I'm gonna bring her up to mid-range, try and break her out of it. Good. And then we are going to do the semitendinosus. So she is going to be laying prone. She is going to have an inverted foot, and then she's going to try and flex it. Oh, I screwed that one up. Semitendinosus, internally rotated the knee, and we're going to try and flex the hip. Good. I'm gonna do it on the other side. Good. And then we're gonna do a break test. So we're gonna bring her up to mid-range, try and break her out of it. Good. On the other side, we're gonna bring her up to mid-range and try and break her out of it. Good. And then the tibialis anterior, we are going to have her feet hang over the table. So we are going to have her dorsiflex her foot and invert it. Good. All right, so we are going to do the tibialis anterior nerve. So we're going to put one hand here and then one hand on the end of the foot. Dorsiflex and inversion. Good. Break test. And then we are going to do the other side. Dorsiflexion and inversion. Good. And then we're going to do a break test. Bring it up to the midpoint. Try and break her out of it. Good. Do the dermatomes. So the first one we are going to test is L2, which is an proximal thigh. For light touch, deep touch, and then pinprick. And then L4 is going to be the anterior knee, medial thigh, and then medial border of the foot. So we're going to anterior knee, light touch, anterior knee, light touch, deep touch, deep touch, and then pinprick. And then we're going to have you do L5, which is, so L5 is the lateral thigh, lateral leg, lateral and dorsum of the foot. We're going to do light touch, lateral thigh, deep touch, and then pinprick. Have you flip over and do S2. So S1 is the lateral thigh, lateral gastroc head, lateral border, lateral malleolus, and lateral border of the foot. Join S1. Feel those? Good. Good. Deep touch. And then pinprick. Feel everything? Good. And then S2 is medial thigh, medial hamstring, and then stopping there. And then we're going to the medial longitudinal arch. So we're going to light touch. Feel everything? Light touch. We're going to start at medial hamstring and then go immediately to the medial longitudinal arch of the foot. Feel everything there? And then we're going to do some deep touch. And then deep touch, I think feel good there, and then pinprick. So we are going to be testing the myotomes. The first one is L1, L2, which is for hip flexion. Both sides, test bilaterally. And then L4, which is dorsiflexion. We're going to see if you're going to ankle dorsiflexion. Good. And then good. And then we're going to have her flip over. And then S1, we're going to do hip extension. Good. S1, hip extension. Then S2, knee flexion. Good. S2, knee flexion. Good.